Hello! In this video, you'll learn how to capture a toothprint with an iTero 3D scanner for InBrace case submission. Together, we'll be reviewing best practices for maintaining a dry field for scanning, and tips and tricks to help you achieve the most accurate toothprint possible in a timely manner. InBrace requires a minimum of 5 millimeters of gingiva on both lingual and labial surfaces in order to create their customized indirect bonding trays. First, let's review the key components of the iTero 3D scanner. The touchscreen monitor for creating new patient files, opening new patient files, and navigating your captured model during the scanning process. Next, the scanning unit, also known as the wand, connects to the device through a detachable scanning unit cable with a USB connector. Before every scan, it's crucial to check that your cable is connected to the device and monitor. The most common failure to capture can easily be linked to a disconnected cable. The wand has 3 key components to it: the protective sleeve, the 2 side buttons, and the touchpad. The blue protective sleeve that protects the scanning unit must be removed and replaced with a disposable sleeve before every scan, and change back to the blue protective sleeve after every use to ensure the capturing lens is always protected from damage. The wand has 2 side buttons. Pressing any button once will start and stop the scanning process. By pressing both buttons simultaneously, it will activate the wand's touchpad to navigate through the different scanning phases: lower arch, upper arch, and bite. This can be done by swiping left and right. To reactivate scanning, simply click either of the 2 side buttons. Now that we reviewed the key components of the device, we can move on to the most important piece of this training: the how to capture a toothprint part. To begin, let's review some items to add to your setup that will come in handy throughout this tutorial. Our setup includes, but isn't limited to, 3-way syringe for initial drying of the facial and lingual surfaces, and an intraoral mouth mirror for when you need to retract an overactive or large tongue during capturing of the posterior teeth. We prepare our patients for the scan by draping them with a patient bib and placing protective eyewear. Now, doesn't she look rad? Ergonomics plays a key role in capturing the ideal scan. Consider seating your patient in a slightly upright position when capturing the lower arch and a fully reclined position when capturing the upper arch. Some videos you may have seen suggest staying at the 12 o'clock position for the duration of the scan, but we've found it easier navigating around the patient from 12 o'clock and back and forth between 10 and 2 o'clock in your chair. This mitigates strain on the wrist and provides an overall smoother toothprint experience for yourself and your patient. To prepare the patient's mouth for scanning, first inspect the patient's mouth for any debris that you may not want to capture in the scan, like this. This can be removed prior to scanning by either having the patient brush, prophy polishing, or oftentimes can be solved with a simple flush and suction with a 3-way syringe. Next, use a 3-way syringe by drying the facial and then the lingual surfaces. Remind your patient to focus on breathing through their nose during the scanning process and to avoid closing their mouth as to not fog the scanning lens, and to request a break to rest their jaw by raising their left hand throughout the process. Yes, exactly like that. We begin the capturing process by scanning the occlusal surface of the lower arch, starting at the most posterior molar gliding toward the anterior while watching the live feed on the scanner in the lower left monitor rather than looking into the patient's mouth. As a right-handed operator, you'll feel most comfortable at the 10 o'clock position, and as a left-handed operator, you'll find this most comfortable at the 2 o'clock position. Your wand will be placed horizontally during your scan. Remember to retract the lower lip with your free hand by stabilizing their chin in the palm of your hand and using your index finger to retract the lip as you navigate around the lower anterior teeth to avoid missing the incisal anatomy of your patient's teeth and capturing the lip in your scan. Once you've reached the last molar of the opposite side of the arch, roll your scanner to the lingual surface holding your wand at a 45-degree angle. As you move from posterior to anterior, roll your wrist back and forth slowly, advancing from tooth to capture interproximal spaces. Remember, it's important to make sure you capture a minimum of 5 millimeters of gingiva for all teeth on the lingual, facial, and buccal surfaces. InBrace develops 3D printed indirect bonding trays using your patient's toothprint and requires this anatomy to design the most accurate fitting tray. In situations where the patient has an overactive tongue or a larger tongue, you may find it difficult to capture the patient's molars. Here's a tip: using a mouth mirror and your non-dominant hand, you can retract the patient's tongue and dry the lingual surface before scanning. This will ensure a dry field devoid of interference. Often, clinicians find they can retire the mouth mirror once they've reached the first premolar. At the anterior, adjust your chair position to 12 o'clock, scanning until you reach the canine, and then adjust your chair back to your preferred 10 or 2 o'clock position, depending on your dominant hand. Moving to the buccal, focus on rolling the wand to the most distal part of the last molar. This can be difficult, so a simple trick is asking your patient to close slightly, as this will allow us easier access to the molar by relaxing the patient's jaw muscles. You may find some moisture has accumulated on the buccal. This is where the 3-way syringe will come in handy for removing any accumulated moisture between interproximal spaces. Roll your scanner to the buccal surface, holding your wand at a 45-degree angle. As you move from posterior to anterior, roll your wrist back and forth, slowly advancing from tooth to capture interproximal spaces. At the anterior, cradle the patient's chin in your palm, using your thumb to retract the lower lip. Some clinicians find this easier at the 8 o'clock or 4 o'clock position. You'll find holding your wand vertically is most comfortable for this part of the scan. Once you've reached the last canine, you can move back to your preferred 10 or 2 o'clock position to finish scanning the other side of the mouth without having to pause the scan. To ensure your anatomy stitches, scan the occlusal of the molar on the side you're scanning first before rolling to the buccal and advancing to the anterior. Now you've completed the lower arch, use the touchscreen monitor to navigate your captured model and check for any missing anatomy you'll need to revisit. Here's a tip that'll keep your Toothprint's file small and save you from overscanning. Hold your finger to the scanner of the touchscreen and a new navigation will appear. Select the option that reads Fill. This feature of the iTero 3D scanner highlights all missing anatomy and limits the scanner to capturing only those missing voids. Moving on to the upper arch, remember to select the upper model in the touchscreen monitor. You also have a feature on your wand to navigate the selected segments that can be accessed by clicking both buttons near the tip of the wand. This will activate the touchscreen pad on the top of the wand. You can select between models there by swiping left or right without having to touch the screen. Adjust your patient to the reclined position and repeat the same steps as you did with the lower arch for the upper arch. Start with the occlusal, holding your wand horizontally in relation to the patient's jaw, and capture the tooth print using the same tips and tricks we reviewed for the lower arch. For the lingual, remember to roll your wrist back and forth and hold your wand at a 45-degree angle as you capture those interproximal spaces. To ensure your anatomy stitches, scan the occlusal of the molar on the side you're scanning first before rolling to the buccal and advancing to the anterior. After completing the upper arch, if you see any voids within your toothprint, press and hold the center of your model until the navigation appears. When it appears, select Fill to highlight the missing voids, then scan to fill those voids before moving on to the next part of your toothprint. Last, we advance to capturing the patient's bite. Check the patient's bite before scanning. Here's the tip. Ask your patient to open wide and place their tongue to the roof of their mouth and hold it there as they slowly bite down. This will show the patient's true bite. Select the bite on the touchscreen monitor before scanning. Have your patient open wide, retracting their cheek on the side of the mouth you plan to capture first. Replace your finger with the tip of the wand and have the patient bite down tight. Remind your patient not to shift their jaw during this process. Start by capturing the molars holding your wand horizontally in relation to the patient's jaw, and raise the wand up and down as you advance toward the canine. Once you've completed the capture, the scan will appear purple, and the jaw will articulate. Do the same for the other side of the patient's mouth, until stitching completes. Select the icon at the top of the touchscreen navigation that displays a magnifying glass. This will lead you to post-processing. Post-processing will take a few seconds to piece all the images together and will notify you if any touch-ups are required. If touch-ups are required, click OK and select each arch to inspect for any blue marks that will indicate missing anatomy that requires recapturing. Once post-processing is completed, select the envelope icon at the top of the navigation for sending your toothprint to the InBrace portal. Congratulations! You have now completed your patient's toothprint. Well, this completes how to capture a toothprint with an iTero 3D scanner for InBrace case submission. Check out our other technique videos available on YouTube and on the Smile Design Studio at portal.inbrace.com.